Hi guys, there seems to be a huge problem with the media when it comes to interviewing politicians and getting to the core problems we face in society. So as we get closer to the Irish general election, three main issues are going to be on the ballot paper: cost of living, housing and healthcare. There has been a massive problem in the health service for decades, the lack of beds in hospitals, which has resulted in more and more patients being treated on trolleys. Finally, it seems politicians are talking about this, but the journalist here tried to derail the conversation.
What's the Labour Party saying on this?
I think the big failure of this government is staffing. It's a failure to recruit and a failure to retain staff. And I know the Minister has said that there's more people working in the health service than ever before, but it has not kept pace with the population in this country. In fact, since 2006, we've had a near 20% increase in population. We've only had a 12% increase proportionally in our healthcare staff. We have a crisis in recruitment and retention, and this government and this Minister has failed to keep staff in our health service. Okay. It is not an attractive place to work.
The trolleys? And first of all, are you saying that you will solve the trolleys? In 5 years with the Labour in government, are we going to see no more people on trolleys?
That would be everyone's ambition, but no one.
Given that
the health service is in such disarray in terms of access to acute hospitals, I think it'd be foolish to make that promise. But it is the ambition. But if we get the staffing right, if we can keep our staff, and if in our acute hospitals, like in Beaumont Hospital, for example, we need which is my local hospital, we need increased staff. But what the professionals are telling me there is they actually need more space. They need an actual bigger A&E. They need bigger resus. They need more ICU space. These are the things that they're asking of this government that haven't been given, and that's happening all over the country. The Minister says that there's outliers in terms of trolley.
So that sounds costly and it sounds timely. So I know Sinn Féin or the Labour Party haven't launched your health policy as of yet, but I don't. Can you tell me, are you going to give any commitments on timelines in relation to the issue of trolleys?
We're going to be giving commitments in terms of hiring staff and a commitment to hiring and recruiting and retaining staff. The reason we have a waiting list crisis in this country is because we don't have the healthcare professionals, the social care professionals, the children's disability network teams at the end of those waiting lists to treat the most vulnerable and sick.
Okay.
See, the problem here, the trolleys is a symptom of the problem. The problem is staff. There's no point talking about, are you going to reduce the number of trolleys? That's the symptom. You have to go to the core point, which is staffing levels. There aren't enough staff. Now, he also mentioned here you need to have maybe bigger departments. But first of all, you need to retain staff and you need to hire more. As was pointed out, the population has increased, but the number of doctors, nurses, medical staff you need have not increased. So what you're hearing from the government, and you hear this from governments all the time, we're spending record numbers or we have more staff than before. The question has to be, is it enough? Well, obviously it's not enough. See, governments will say, look, we've invested in new technology, we have the most advanced MRI machines in the world or whatever, but there's no point having the most advanced equipment in the world if you don't have the staff to operate it. So when we talk about beds, we're generally talking about staff. You need doctors. For a patient in a bed, you need a certain number of staff. If you don't have those staff, then you're having problems with beds. So what needs to happen is you need to first recruit, you need to retain staff by paying them better, improving their conditions. And then you need to recruit new staff. Now, if that involves going around the world and bringing people to the country to work in the healthcare sector, be it. But it's completely unacceptable that for decades now, people are being treated in trolleys in corridors because they don't have the staff, to operate the beds. So instead of focusing on the trolleys, you need to focus on the core issue, which is the staffing levels. So it would make more sense for the journalist to ask the questions like, okay, how many workers are you going to recruit? How much are you going to spend on recruitment, on retainment? That should be the question. How many doctors are you going to hire in the first year if you were in power? How many nurses? How many are you going to retain? What sort of policies are you going to put in place to retain them, to increase staffing levels? Because that's the core problem here. Once again, the trolleys is the symptom. The trolleys is what people see on TV, is what they see when they go into the hospital. But that's the symptom of the problem. The core problem, of course, is staffing. And when politicians from the government say, well, we have record numbers or we've invested more than anyone else, it needs to be called out. It needs to be asked, is that enough? And obviously it isn't. This is going to be a core issue going into the general election. And it's important that when politicians eventually get elected, that they're held to account over this. Because I keep saying, what's the point in having a government if it doesn't look after the health of its citizens? Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.